ليتك دوما قريب. Everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, peace fills up the air. Ramadan, month of the Quran, I feel it inside me, strengthening my iman. But how I wish you'd be here with me all year around. Ramadan, 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 ya Habib. Ramadan, Ramadan, ليتك دوما قريب. Love is everywhere, so much peace fills up the air. Ramadan, month of the Quran, I feel it inside.
Assalamualaikum warahmatullahi wabarakatuh. Can anyone hear my voice? I think we shall start, yeah? Okay, Assalamualaikum warahmatullahi wabarakatuh to all participants. Bismillahirrahmanirrahim. All praise is due to Allah subhanahu wa ta'ala, for it is by His grace and permission that we have come together once again in this CME Ramadan series. Alhamdulillah, we are now at the third series of this Ramadan CME. So before we begin, let's all start with Ummul Kitab. First of all, let me introduce myself first. I am Dr. Norazwani Azwal. I am your moderator for today's CME. Alhamdulillah, today marks the 18th day of Ramadan. May this holy month bring numerous chances to fill our lives with goodwill and build a path to self-development. May Allah subhanahu wa ta'ala forgive us all and guide us toward becoming our best selves. It is with great pleasure that I welcome you all to today's talk on a topic of utmost importance during the blessed month of Ramadan. Today, we delve into the intricacy of those who, due to medical reasons, are unable to fast during this sacred time. Ramadan, as we know, is a month of fasting, prayer, reflection, and community. However, it's crucial to recognize that not everyone is able to participate in fasting due to various health conditions. Understanding these conditions and their implication is essential for our community's well-being and inclusivity. Throughout our session today, we'll explore the medical conditions that may exempt individuals from fasting, the Islamic rulings surrounding these exemptions, and the spiritual and practical consideration for those who find themselves in such circumstances. It is my pleasure to introduce our distinguished speaker for today's CME on the topic of who cannot fast for medical reasons during Ramadan. Our speaker for today is Assistant Prof. Dr. Noor Asikin, Binti Muhammad Sakri. She is a specialist and clinical lecturer in Obstetric and Gynaecology Department. Dr. Noor Asikin earned her Bachelor of Science in Biotechnology from University Putra Malaysia in 2007. Subsequently, she pursued her second degree, obtaining her MBBS from UniKL Royal College of Medicine, Perak in 2013. Following her undergraduate studies, Dr. Noor Asikin completed her housemanship training at Hospital Kemaman. In 2018, she embarked on her master's program in Obstetric and Gynaecology, where she underwent rigorous training at Hospital Tengku Ampuan Hafzan and Susmak IUM. Her dedication and commitment culminated in the completion of her Master of ONG from IUM in June 2022. Dr. Asikin brings a wealth of clinical expertise, particularly in pediatric adolescent gynecology, which is her special interest. Her passion for advancing her field is evident as she plans to pursue a subspecialty in the near future. Furthermore, Dr. Noor Asikin is actively involved in academic and professional initiatives. She served as one of IOHK members representing the ONG department and acts as an advisor for Postgraduate Society. Beyond her professional achievements, Dr. Noor Asikin finds fulfillment in her role as a spouse and parent, blessed with 2 wonderful children. Before we begin the CME, I have a few housekeeping announcements to make. Please keep your microphone muted when you're not speaking. Please feel free to hold on to your questions or comment until the Q&A session at the end of the talk, or you can type your questions in the chat box during the presentation, and we'll address them during the Q&A session later. The link for I-Attend and CPD points for doctors will be shared at the end of this CME. Without further ado, let us warmly welcome Assistant Prof. Dr. Noor Asikin Binti Muhammad Sakri to share her insight on this important topic. Dr. Noor Asikin, the platform is yours.
Assalamualaikum warahmatullahi wabarakatuh. Can you hear me, Dr. Azwani?
Yes, I can clearly hear you.
Okay, thank you so much, Dr. Azwani, for the kind introduction. I'm Dr. Asikin, for a specialist and also clinical lecturer from the ONG department. So, wait, I just share my slide. Okay, so Alhamdulillah, today we're going to talk about the CME Series number 3 regarding the Ramadan fasting. You cannot fast for the medical reason. Okay, I just want to give some discrimination that this is a bit broad topics to me. Maybe I will talk a little bit about the medical things, and then I hope our colleague from the medical can also share some input from me. Okay. Okay. Basically, we know that Ramadan is one of our pillar of Islam, and then during this Ramadan, all the adult Muslims are obligated to fasting, which is constrain ourselves from the eating any food, drink, and also do that something that could invalid our fasting. Starting from the before sunrise until to the Maghrib. Okay. Obligation of the fasting is it's obligatory upon every Muslim at the age of puberty. However, from the medical point of view and religion in particular, the sick person is required to leave it if it's not capable of fasting. As we know, we have a ruksah in the Ramadan, especially for the sick person. Okay. And then they should not fast and try to make up for it in the qada. I mean, they need to replace the fasting that which one she is. And then if they want to pass we need to monitor, close monitoring is required. If it's harmful, they are allowed to break the fast. Okay. And then for the specific patient, for example, our chronic patient and also pregnant woman, they should consult the doctor and also pharmacist, especially in patient who was on the special medication on, for example, in diabetic, was on insulin, and they need to counsel, they need some discussion with the pharmacy how to adjust the medication. And then they can proceed with the fasting, provided they comply with the dosing of the schedules, control the diet, and follow the doctor advice. Okay, as we know that there is some ruksah in the fasting, as mentioned in Al-Baqarah ayat 184. Which one you know that for patient who are on journey, musafir, and also patient is poor, patient is for elderly patient who cannot make it a fasting. For this group of patient, there is a ruksah to break whether she cannot fast or maybe she will try to fasting for a few hours, and then if she cannot make it, it can break the fast in between the days of try to fast. Okay, and then but as we know that if we need to decrease all the fasting day that for before this. Okay. But in this ayah also it's mentioned that the fasting actually is best for you if you only know. That means you need to try the fasting first, but if you can't do it, you may break in between of the fasting. Okay, so important of medical consideration, why fasting can have spiritual and also health benefit. As we talked before this in CME number 190, it crucial and considered medical factor also. So So in certain medical condition, maybe the fasting is contraindicated, or maybe need some require some modification, okay, in order to help patient to fast. Okay, so in this topic, I would like to talk some medical issue in the Ramadan, whether this type of group of patient we need to allow of fasting, uh, or we should say that she should against the fasting. Okay, for this topic, I would like to focus on a few patient, including diabetic, cardiac patient, stroke patient, kidney disease patient, and fatty ulcer patient, chronic liver disease, and also in pregnancy and also in breastfeeding patient. Okay, for the diabetic Ramadan fasting, as we know, in patient with the type 1 diabetes, the glucagon and also epinephrine secretion may fail to increase the response to the hypoglycemia. So during the prolonged fast, in the absence of adequate insulin, can lead to excessive of glycogen breakdown and increase the gluconeogenesis and ketogenesis, leading to high risk of hypoglycemia and also ketoacidosis. Okay, and then for type 2 diabetic patient, prolonged fast may lead to hypoglycemia depending on the extent of insulin resistance or deficiency. But the ketoacidosis is uncommon in type 2 diabetics. Okay, so in this patient, in this group of patient, we need to have a risk stratification. Okay, in this, the patient is categorized as very high risk patient. The fasting is not allowed in the Ramadan because it may give a high risk morbidity or mortality to the patient. Okay, so for the very high risk category, including the patient who has history of severe diabetic complication within 3 months prior to fasting. For example, she have severe hypoglycemia, ketoacidosis, hypoosmolar hypoglycemic coma, recurrent hypoglycemia. Our patient is also who unaware about the hypoglycemia symptom. Patient has acute illness, patient that sustained poor glycemic control, which is HbA1c is more than 9%. Patient is pregnant, especially who was on the medication or insulin injection, and also patient who has advanced renal failure or chronic dialysis. Okay, so in this category for high risk and also moderate risk, the fasting is not preferred to the patient. It's only the low risk patient who has a well-controlled diabetes that only treated with the lifestyle modification or single agent, such as metformin, acarbose, or in this type of patient that we can allow to fasting during Ramadan. Okay. And then patient also need to be advised or need to be reminded that when to break a fast. Okay, so if she experience any especially any symptom of hypoglycemia in which patient who have no self-monitoring blood glucose at home, so she is need to be advised to break her fast. Okay, for patient who have self-monitoring blood glucose at home, so if the blood glucose is less than 3.3 millimole per liter at any time during fast, or blood glucose is less than 3.9 the first few hours of fasting, especially patient taking sulfonylurea or insulin, blood glucose is higher more than 16.7. This group of patients, they are need to break their fast. Okay. Okay. So I think for the diabetic patient, we is quite well versed on us. Last time we also have a CME on the diabetic management modification that given by Dr. Saiful previously, I think. Okay, so for the second group of patient, in cardiac patient, okay, for the cardiac patient, we also need to have a risk stratification, whether the patient is very high risk or low moderate risk. Okay. And then first we need to ask the patient whether the patient have intention to fasting in Ramadan or not. If she has no intention to fast in Ramadan, we can continue the current management as per usual. But if patient have intention to fasting, we need to classify the patient whether it's high risk, very high risk, or low moderate risk. In very high risk and high risk patient, very high risk patient actually it's not recommended to fast. But in high risk patient, we can say to patient you can try to fast, but in certain with the close monitorings, okay. And then we consider patient, but patients still want to fast and proceed fasting. We need to explore or alternative, safer alternative. For example, we ask patient to fast in every other day, non-conservative fasting, or fast in the shorter day, especially in abroad in the winter time or something. If patient is decline our advice or it is unsuitable for alternative, we need to give a risk communication to the patient. If patient aware of health consequences of Ramadan fasting and that they are fasting against the medical advice, we need to document patient risk status, patient decision to fast, and also recommendation for them not to fast in clinical not properly. Because if anything happen, for example, patient having morbidity or mortality because of fasting, this is will be have an issue later on. Okay. So we also need to do the risk management, advise the patient to speak to the local scholar about their decision, counsel patient about risk of dehydration, fluid overload, electrolyte abnormality, and also nutrition requirements. And also consider alternatives to the medication as appropriate and feasible. Advise about the sick day rules and terminate the fast if she or he become unwell. And consider the trial of fasting. For example, 1 month before the Ramadan, that patient fasting maybe a few days before the start the Ramadan months. Okay, but for the low moderate risk patient, the patient maybe can try to fast, but we need to advise the patient if the patient is taking cardiac medication, they need to optimize and compliant and need to monitor closely the medication. Maybe need to do some modification regarding the dosage or the frequency of the medication. And then need to talk to patient, inform the patient about risk status, document the patient risk status and patient decision to fast. And then for the risk management, counsel patient about the risk, hydration, fluid overload, electrolyte abnormality, and also nutrient requirement. Okay. Okay, and also the same, just maybe patient need to need to remind about the sick day rule and also need to terminate the fasting is become unaware and can ask patient to try the fasting before the Ramadan month. Okay. Okay, so okay, this is the risk certification that I mentioned before. This is following the IDF DAR, which is International Diabetes Foundation and also Diabetes and Ramadan's Alliance, the risk category. So for the cardiac disease, moderate and low risk is include the stable hypertension, stable angina, implantable loop recorder, permanent pacemaker, and so on. For the high risk patient, which should not fast, with poorly controlled hypertension, recent acute coronary syndrome, myocardial infarction less than 6 weeks, hypertrophic cardiomyopathy with obstruction, global disease, severe heart failure, poorly controlled arrhythmias, and high risk for fatal arrhythmias. And then for very high risk patient, which is must not fast, advanced heart failure, and also severe pulmonary hypertension. Okay, so this is the suggestion. This is the suggestion at least for pre and post Ramadan checklist for patient with the cardiovascular disease. We need to establish the patient background, previous Ramadan fasting experience, symptom status, smoking status, cardiac and other medical history, review the research investigation, review electrolyte, ECG imaging, and also intracardiac device check. We need to do risk certification, communication and management, the patient, and general Ramadan advice. For example, healthy diets and fluid intake, smoking, break fasting, opportunity for smoking cessation, terminate the fast is feeling unwell, Okay, and then mention to the patient, intramuscular injection and also sublingual medication does not break the Ramadan fasting if she needed. And then post Ramadan review, try to explore the experience of patient fasting during Ramadan, and then the symptom status changes. Okay, the third one is in the cerebrovascular disease group. Is there any effect on Ramadan fasting on stroke incidence? This is a study done in the Hamad General Hospital involving 13 years of stroke database. The patient, they look on the patient admitted with the stroke were compared in relation to month of fasting, 1 month before, 1 month during the month of Ramadan and 1 month after the Ramadan. The study involved 335 Muslim patients who were admitted over the 13 years period. The incident stroke was 29 patients, meaning that 30 before the Ramadan, 29 patients during the Ramadan, and 29 patients post 1 month Ramadan. Okay, so the clinical characteristic, they look on the age, gender, cardiovascular risk factor profile, medication. It been said that there is no significant difference between the periods. Okay. So in this study, conclude that the fasting during Ramadan does not increase the frequency of hospitalization for stroke. And then there is no, significant difference between the stroke rate in the Ramadan fasting month and other non-fasting month. So for the patient with the stroke, we can advise her to try to fasting. If she able to fast, she can continue the fasting. If not, maybe she can include in the category of sick patient. Okay. Ramadan fasting and also kidney disease. In healthy person, Ramadan fasting does not induce any abnormality for urinary pH volume, osmolality, solute and electrolyte excretion. And also the changes in urea, creatinine, sodium, and potassium are usually insignificant. And then there is one study done by IOHK et al. Performed that prospective study on 15 pre-dialysis CKD patients who did fast during Ramadan. The study showed that the change of GFR was not significant difference in CKD patient compared to the control group. Okay, so all CKD patients that tolerate fasting without any complaint and have no difficulty regarding timing or dosing of the medication. Okay. And then this is the clinical assessment tool, which is involved 3 A's, assess, advise, and assist. This is from the consensus recommendation on fasting during Ramadan for patients with kidney disease. In this patient, with the kidney disease, patient want to fast during the Ramadan, we need to have a risk classification. Need to assess the risk classification patient, whether the patient is included in the low, moderate, or high risk factors. For the low risk factor, which is eGFR more than 60, moderate risk factor, eGFR 50 to 60, which is proteinuria more than 1 gram per day, kidney transplant recipient more than 12 months, and who have kidney stone. The high risk patient is ongoing acute illness, AKI, eGFR less than 30, dialysis with comorbid kidney transplant with less than 12 months, the previous fasting experience. Okay, so we should advise the patient in terms of fasting safety. Okay, in the low risk patient, the fasting is probably safe. Moderate risk, the fasting is uncertain. The high risk patient, the fasting is probably unsafe. So he against the fasting at this point in high risk group of patient. Okay, and then the last one, we need to assist in terms of monitoring of the patient. We need to do the adjustment of dietary and fluid intake of the patient, adjustment of medication, dose and schedule if needed, and then rule of the breaking the fast. We need to advise the patient. She or he need to know what is the point when she need to break the fast. Follow up in aspect clinic pre, during, and also post Ramadan. Okay, so this is rule of early termination of fasting. So patients should know that at this point of condition, she or he need to break the fast, especially in any acute illness causing, for example, patient having fever, diarrhea, exhaustion, vomiting, any condition requiring hospitalization, trauma, suspected cardiovascular event, patient who have acute kidney injury, noted on laboratory investigation, patient who have hyperglycemia, blood glucose more than 16.6 milligram per liter, or hypoglycemia, blood glucose less than 3.9. Even a patient is asymptomatic, so she also need to break the fast. And then patient with the kidney transplant patient who missed taking his immunosuppression medication at sahur. So this is the rule of early termination. Okay, so the next group of patient is patient who have peptic ulcer diseases. There is a fall in gastric secretion during the prolonged fasting, and also gastrointestinal tract movement occur every 2 hours. So the gallbladder also empty 1 to 3 times every 4 hours. But less frequently than in the fed state. The complication of ulcer in fasting patient has been reported. Incidence of duodenal ulcer population is relatively high in Ramadan or more the people who are fasting. So history of dyspepsia in patients who are fasting is an important predisposing factor for duodenal ulcer population. So patient with complicated peptic ulcer may be advised against fasting. Okay, asymptomatic patient may try to fast, but maybe she need to be covered with the ranitidine or PPI at the iftar and also sahur. Okay. Okay, so the next patient is patient with the chronic liver disease. Okay, there is a study done by Nadri Amish et al. Study total 222 patients with chronic liver disease. It's been told that involving 103 patients fasting and 99 patients who's not fasting. And then the result is the dyspeptic symptom in the fasting is higher compared to the non-fasting group, which is 53.4%. And GI bleeding also higher in the fasting group, 70.5%. And then liver function in the fasting group show no significant change pre, during, and or the post-Ramadan regarding the chronic hepatitis. And also, this group of chronic hepatitis has no significant changes during pre, during, or post-Ramadan regarding the liver function. So, okay. But in the fasting cirrhotic patient developed worsening the condition, which is developed child class 3 in about 30% during and 32.6% after Ramadan compared to 0% before the Ramadan. So this is need to be emphasized again the fasting in especially in the cirrhotic patient. Okay. So last but not least, the depression was in pregnant patient and also a breastfeeding mother. So in pregnant woman, she can avoid fasting in Ramadan if there is probability of harm her or herself or the fetus. Okay, similarly to the lactating mother, if she worry about her baby or herself, she can postpone the fasting and need to make up in the other days to conduct the fasting. Okay, and then if it is certain the permanent or lactating woman may endanger her or child, born and unborn, by the fasting in Ramadan, she should be advised strictly against the fasting and to compensate in other time of the year. Okay, for the pregnant woman, especially who have morbidity such as diabetic mellitus on medication or hypertension on medication, we are not suggest her to fasting during Ramadan because it's one is issue with the medication adjustment, and the second thing is issue with the symptom hypoglycemia symptom, and also for the hypertension, sometimes we need to give the patient TDS doses of the antihypertension to control her BP. Okay. And then for breastfeeding mothers, some may fasting if she have adequate energy to breastfeed and also to fast. Okay. Okay. So the next one, I will talk on the ruling on breaking or invalidating the fasting for this type of patient, example for a sick patient or pregnant lady or breastfeeding woman. So for someone who intentionally break or invalidate the fast, due to the method permitted by Sharia, is it obligatory for them to make up for their fast as follow, whether the qada only or qada along with the fidyah only or qada along with the kafara, which is this number 4 is not really related with the medical issue. Okay, so the qada fasting for those who miss due to illness, the ruling for someone who passes away without being able to make up their missed fast is divided into two situations. Whether the someone is passed away without being able to make up their missed fast due to continuous excuse, or there is no opportunity right for them to make up the fast, such as illness, chronic illness. She's on traveling, unconsciousness, postnatal bleeding, pregnancy, or breastfeeding, and this excuse persisted until their death, then it is not obligatory upon their here to make up the missed fast or to pay fidyah on their behalf. But if the deceased could potentially make up the missed fast, but there is an opportunity for them to do so, but they intentionally did not do so until their death. In this case, there are two opinions. Whether first is we can deduct from the deceased estate, the deceased estate, and also the second, the guardian or maybe her child need to make up the missed fast and need to pay the fidyah on behalf of the deceased, whether the parents or the siblings. Okay, the qada fasting along with the fidyah. In this group, including the individual who delay making up missed Ramadan fast until the following Ramadan. So, including the pregnant woman who break their fast due to fearing harm to the fetus, mother who breastfed their children and break their fast due to fearing insufficient milk for their child. Similarly, the ruling applies to mother who are hired to be breastfed infant. Okay, so in this category, in this three type of the people, they need to conduct the fasting and also need to pay for the fidyah. Okay, the last one is pay for the fidyah only. Fidyah only including the patient who, in case of the incurable illness that confirmed by the medical professional, fasting is not obligatory, but only fidyah payment is required. And also in elderly individuals who are no longer able to fast Ramadan due to the incapacity, only obligate to pay the fidyah. Okay, so in these two categories, no need to conduct the Ramadan fasting. Okay, I think the conclusion for me is the fasting can offer various benefits, but it's essential to prioritize individual health. Okay, and then the patient need to consult with the healthcare provider regarding her medical condition, whether she's able to fast or not. Fasting really need to discuss with her doctors. Okay, and then the personalized plan to ensure safety and optimize well-being during the fasting practice. We need to have the personalized plan for the patient, especially patient who has chronic illness, in order to help her or him to undergo the fasting. Okay, I think that's all for me. Okay, is any other question from the floor?
Okay, thank you, Dr. Asikin, for your enlightening and insightful presentation. So now I'd like to open the floor for questions to our speaker. Any questions? You can ask directly to our speaker or you can write on the chat box. Okay, maybe one question from me, Dr. Asikin. I just want to ask you regarding if a pregnant lady with underlying anemia, is the patient allowed, can the patient fast? Or what is the optimum HB that patient are allowed to fast?
Okay, Okay, for the anemia patient in pregnancy, usually we have a cut point of 11 gram per deciliter, which is a good cut point lah. Is more than 11 if you go for the patient. But actually it depends on the trimester of the patient. Okay, sometime in the second trimester, there is some hemodilution. But before this, we need to rule out any other pathologic causes of the anemia lah. For example, thalassemia or iron deficiency anemia. So in second trimester, the HB can be a bit lower compared to the first trimester. And then usually the third trimester, it become around 10.5 above, it should be normal. Okay, for the anemia in pregnancy, actually the patient can fast if the anemia is just mild anemia. For example, maybe it's around 10. Okay, but the patient is very severe anemia, less than 8 gram per deciliter. First, we need to rule out the causes of the anemia, and then maybe we need to treat them properly, whether need to give blood transfusion or IV parenteral iron. But the most important, yeah, as we know, the nutrients or the food is also the main contribution also to the anemia patient, especially in iron deficiency anemia women. Okay, but as far I'm treating the patient with anemia, we still advise her to fasting. It is different patient compared to patient with the diabetic mellitus or hypertension, because it's quite difficult to control, to adjust their medication or to control their blood pressure if she not taking the medication properly. Compared to the anemia in pregnancy, we can advise patient to take the iron tablet at night. So she can fast during the daytime. Okay? But it depends on the severity of anemia also.
Thank you, Dr. Asikin. So is there any more questions?
Assalamualaikum. Thank you very much, Dr. Askin, for your sharing. I actually like to hear regarding your discussion on peptic ulcer disease just now, because I think it's quite common from our patients when they have dyspepsia. There's always actually blaming is possible gastritis, ulcer, and they tend not to fast because based on their experience they have this gastric pain. So my question is that how actually you would like to advise those with dyspepsia, but actually the diagnosis is not confirmed yet. Should we just rely on their symptoms to advise on the fasting, or need further investigation? Thank you.
Okay, thank you, Dr. Saiful. I think from my knowledge lah, for the peptic ulcer or gastritis, it's quite common in Malaysia. But first, maybe we need to confirm the diagnosis. Sometimes patient assume that she having gastritis or peptic ulcer, but without the confirmation, maybe we need to refer them, or we need to the surgical to do some maybe OJDS to confirm the diagnosis. But in patient, if frequent having the gastritis, the diagnosis is confirmed, it's easy for us to manage. For example, maybe we can supply them with the PPI, or even ranitidine, or maybe pantoprazole to supply them with the medication, or and advise them to take prophylactic medication maybe during sahur and also during iftar, the PPI to prevent them from getting symptoms during the daytime. And then try to advise them. Second thing, maybe ask them to take the sahur at near to the it's not advised to take early sahur, maybe a late sahur, and then need to break the fast. Please don't delay in terms of breaking the fast. And then the third one, I think the choice of the food taken by the patient. We need to advise the patient try to prevent taking the spicy food or oily food, especially during a sahur, or maybe also in the iftar, because this kind of food can worsen the dyspepsia especially, and also reflux I think especially. And then if the patient is still the symptom is still worsen, maybe I think Dr. Saiful, we need to refer them to our clinic lah. Maybe we need to refer them to surgical to do a further investigation properly. And maybe patient need to have a OTDS soon. Okay. Yeah, I think maybe surgical clinic don't have any opinion here.
Thank you, Asikin. So I think the important message is that we need our patient to have our follow-up. So I think they cannot just diagnose themselves as having gastritis. Sometimes it can be generalized, sometimes very individualized. So each patient, I think different symptom, different scope of pain. We need to confirm the diagnosis and advise accordingly, like what you mentioned just now. Thank you, Asikin.
Yeah, I agree with Dr. Saiful.
Okay, is there any questions or any inputs? Okay, I think if there's no more questions, thank you once again, Dr. Noor Asikin. On behalf of IOHK members, I would like to extend our deepest gratitude to Dr. Noor Asikin for her informative presentation. We truly appreciate the time and effort she has dedicated to sharing her expertise with us today. I would also like to express our gratitude to each and every one of you for your participation. Before we conclude, I would like to remind everyone of the importance of reflecting on the valuable insights gained from today's CME. Let us carry forward this knowledge into our lives, enriching our understanding and practice as we navigate the challenges and opportunities ahead. We have shared the link for I-attend and see the points in the chat box. Yeah. Okay, thank you once again to our esteemed speaker and to all of you for making today's session a success. Let's end our session with Tasbih Kifara and Surah Al-Nas.
Thank you, Dr. Azwani. Thank you, everyone.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.